Hi, I'm Dr. Lawrence Cooper at the MD Anderson Cancer Center, and I want to tell you a little bit more about what we're doing in the world of T-cell therapy. With me today is Dr. Forget, just a world-class biologist who's helping us develop new therapies, in other words, new T-cell therapies for treating melanoma. So what's going on in your world?
Well, I'm working in adaptive T-cell therapy. So basically what we're doing is that we're taking the lymphocyte that has infiltrated the tumor of the patient.
So lymphocytes being T-cells?
T-cells,
Okay.
yeah. The immune system that infiltrates the tumor.
Okay. So patients say I have, hopefully not, melanoma. You would take out some of my tumor deposits and you would find lymphocytes, T-cells in there.
Exactly.
And then what happens?
And then we take them, we cultivate them in the laboratory, and we expand them to hundreds of billions.
Wow.
And then we transfer them back to the patient.
And what happens when you transfer them back?
The T-cell goes to the tumor and destroys the tumor, hopefully.
That's really good news for the patient.
Yes, it is.
So what are some of the problems with this type of therapy?
Well, sometimes it is difficult to take the T-cells out of the tumor, because some tumors are less infiltrated by T-cells. Sometimes it is difficult to expand the the lymphocyte that has infiltrated the tumor to great number to transfer them to the patient.
And if you don't have the numbers of T-cells, I guess the patient can't get the therapy?
They can, but we have seen that the more T-cell we transfer to the patient, the better the response.
Okay, so it's a numbers game.
It's a numbers
need
game.
more soldiers. Okay.
Yes, and it's not only a question of numbers, but I like the reference that you're using with the soldier, because we need good soldiers.
So we need smart warfighters.
Exactly.
Okay. So in the laboratory, when you're working on your science, what are you doing to make a large number of smart fighters?
I'm trying to find different ways to cultivate these T-cells. I'm trying to give them different, again, with the soldier image, we're trying to give them different weapons to be able to fight the tumor. But also we're trying to give them other weapons to persist into the patient so the cancer does not come back.
Wow. So you're making these T-cells smarter. You're making them smarter by energizing them, by activating them, and helping them to sit around after they've done battle.
And wait.
That's great news. Congrats on your data.
Thank you very much.
So what she showed us, and what is really going to be helpful for the entire field of T-cell therapy, is a new way to grow melanoma-specific T-cells. The culturing environment that she's developed not only helps patients with melanoma, but we're finding the same principles to be applied across the field of T-cell therapy, where we can take what she's learned and put it into other systems so we can grow better T-cells to target lymphoma, better NK cells to target multiple myeloma. On and on it goes. Thanks very much for your help.
De rien.